you ever feel a snapping or popping in the front of your hip? We often feel this when we're moving our leg up and down, especially when doing core exercises like bicycles. This can be a frustrating thing to deal with, but in today's video, we're going to go over what is causing that snapping or popping sensation. And more importantly, we're going to talk about 2 exercises that can help eliminate it completely. Now, we treat a lot of hip pain in our office, and one common symptom or issue that people deal with in their hip is this popping or snapping hip syndrome. And this is a popping or snapping sensation that you get when you move your leg up and down or rotate it out to the side. And it's reproducible. It is something that can happen every time you do that. It's not that joint pop that you get once and it feels good and then it doesn't happen again. This is reproducible. It happens over and over. And oftentimes people wonder what is causing that popping sensation. Usually it's pain-free, but it's weird feeling. It's kind of unsettling and they want it to stop. It's not keeping them from doing anything, but it's annoying. And if this is you, you may wonder what is causing this. Oftentimes people think it is their joint popping in and out of place. Fortunately, the hip joint is a very stable joint. You can see it as a really stable ball and socket joint with a lot of bony integrity holding that hip joint in place. In the absence of certain developmental issues, you're really not going to have your hip joint pop out of place. So what is causing this? They've actually done ultrasound imaging on the hip, and they've found what is causing this snapping or popping hip syndrome. They've found the popping to be coming from a group of muscles called your hip flexors. So you have 2 main hip flexors that are involved in snapping hip syndrome. The one right here is called your psoas muscle. So this muscle starts in your lower back and runs down to the front of the hip here, runs down to your femur. This other muscle that lies under it, and you can see it lies under the psoas, is called your iliacus. What can happen is the psoas, as you move your leg, that psoas can kind of fold back and forth over the iliacus, causing you to feel a popping sensation in your hip. And that's what's causing it. Every time you do it, that psoas is going over that iliacus, and we need to try to figure out how we can stop that from happening. We are going to do 2 things to help relieve the snapping hip syndrome. The first thing that we need to do is we need to stretch the psoas. If the psoas is taut, every time you move your hip up and down, it has the potential to run over that iliacus, causing the snapping sensation. So we want to make sure that there's plenty of flexibility within that psoas. The second thing we need to do is make sure the psoas can function on a stable foundation. And we're going to do that through core work. If we have a nice stable core, the psoas can function appropriately and elongate as it needs to without snapping over the iliacus. So what you're about to see is a great stretch for the psoas, followed by a core exercise to help stabilize everything. So this is a really good way to stretch out the front of the hip, stretch out the hip flexor to help reduce some of that hip popping. So you're going to take a really heavy resistance band, wrap it around something sturdy, and then put it on the leg that you're stretching. And you're simply going to let that band pull you forward, and then you're going to come back against its resistance. Let it pull you forward and come back. You can rep this out, and then at the end of 10 to 15 reps, you're going to hold for about 20 seconds. Yep, exactly, in that nice stretched position. If you don't have a way to set up a band like this, simply going through the stretch without the band is just fine. Once you've done that stretch and loosened up the hip flexor, we want to make sure that we get the core muscles working appropriately and the hip flexor lengthened in an active way. So you're going to lay on your back, use that same band, and you're going to push your hands into the resistance of that band. Make sure you tighten the core by pushing the lower back down into the floor. You want to keep that lower back against the floor the whole time. Then you're going to lift both legs, keeping the knees bent, and straighten one leg out at a time. Okay? It's very common to feel your hip popping while you're doing this, but I want you to stop just shy of that range of motion where you feel the popping. If you do feel that popping, try to engage that core a little bit more or push against the band a little bit more. So I hope that was helpful. Snapping hip syndrome can be very individualized. These exercises can work really well for some people and may not work well for others. So if this is something that you're dealing with, it's important to get individualized care, and we would be happy to help. Please visit us online at TruMotionTherapy.com to learn more or schedule an appointment.